Good afternoon to all. Next plenary session 6, Quantitative Research Design. I would like to invite to Professor Divya Rani ma'am. She is working as a professor Srinivas University, Bangalore, Karnataka. Ma'am has completed her UG and PG from RGUHS, Bangalore, Karnataka. Madam has attended professional training, basic life support, and advanced cardiac life support. Published paper presentation at national and international level. I would like to invite Professor Divya Rani ma'am on StreamYard for proceeding. Over to you, ma'am.
Yeah, thank you, sir, for the brief introduction regarding me. And I would also like to thank the Subhash University for giving me such a wonderful opportunity. And I would also like to thank Professor Sevanthi ma'am for organizing such a wonderful uh, conference. And now I will be starting with the topic. So today the topic what I am going to present to you is will be on quantitative research design. So before moving on to this, I would like to give you a brief introduction regarding what is a research design. Next slide. So you can see the slide here. You can see a particular design of a house, isn't it? So when you see a design of a house, how we plan a particular design, based on that design, we build a house, isn't it? So same like that. Next slide. Next slide. So same like that, research design is a master plan for a research. Here what happens is that in a research design, we plan everything regarding a research. Now, like methods, procedures, how we are going to collect the data, what is the population, and what is the sample size, who is going to be our sample, everything will be decided in a research design. So that will help us to give a good result in a research. So next slide. So moving on to the features of a good research design, how we are going to come to know that the research design is good. First one, objectivity. Objectivity means whatever research you are going to select or the research design you are going to select, that should be accurate, and as well as it should be free from bias. So if the design is such a way, you are going to get a good result. Another is reliability. Now when you are doing a research, you get a result. So same research results, if it is in another situation, we can call that as the particular research design as reliable. Next one, validity. As you all know, when you are preparing a instrument, what we do, you prepare the instrument and or the tool, then you give it for validation. Then you will do a pre-test. So when you do all these things, you are going to get a good instrument. So based on this good instrument, you are going to do the research. So when you do it like that, what happens is that the research you are going to do will be more effective. Next one is information. So whenever you are preparing a research design, it should have adequate information regarding all the things what you are going to do in a research. Next one is the flexibility. So in any point of time, if you find if something is missing or something has to be slightly modified in order to adjust to the scenario, the research design should be such that you can do that. And lack of error. It is also very important in a research design. If there is error, that will affect our research results. So these are the features. Next slide, please. Next is the factors affecting the selection of a research design. So what are the factors which is very essential in how do we know that this particular research design has to be selected? Next, first one is nature of a problem. That is the problem what you are selecting. You should see that it is appropriate. Based on the problem, your research design will be decided. Now, example, if you are going to know anything regarding a particular scenario or you want to get a response from the patient, maybe you will have to choose a qualitative research design. Next one, purpose. That is whether you want to describe a phenomena or you want to explore a phenomena, so or you want to correlate or compare a particular phenomena. Based on that, your research design will be decided. Next is researcher's knowledge. So if the knowledge of the researcher is good, or if the researcher know very well regarding the research design, maybe he will be able to select a best design for his research problem, researcher's interest. This is also another important factor. If the researcher is interested, then in the research process, then it will yield a good research design. Researchers ethics, and ethics and the moral principles are very important in a research. We all know that if the research in the now example, when you are taking a particular research or doing in a respondent, what you do, you take a consent, isn't it, or you select a problem in such a way that it doesn't hurt another individual or another, it doesn't create any harm to the human being. So you have to see all these areas, then you have to select the research design. Next is the participants. So the number of the participants, they also will decide our research design. Resources, it is also an important factor, like the time, the particular the amount, cost, as well as the support from the institution. This also is an important factor which included under the resources. Next is the control on variables, that is external variables which is going to affect the particular research. Now example, you are going to collect an information from a patient who is in the ICU, and imagine the patient, the atmosphere is very cold, maybe it may interfere with your collection of data. Next is the time. So duration for which that research is done, that will affect the research design. Another is users of findings, that is who is going to use this particular research. Next slide, please. Next, how is it classified? So how you're going to divide this particular research designs. Next slide, please. Next slide. Okay. So you can see in this picture, there are two previous picture. You can see there are two pictures are there, isn't it? So the first picture, you can see ice cream man is selling his ice creams, and he is telling that 1 out of 30 ice creams will be free. So in this particular picture, if in case, if the ice cream man is telling, I am going to give one ice cream free for out of 30, and he is telling that I am having strawberry flavor, I'm having mango flavor. So like that, you are going to get a result in numbers. Now example, he is having 10 ice creams, or he is having 30 ice creams, or he is having strawberry ice cream 10. So everything, if you are getting the variables in numbers, then you call it as quantitative research design. Next box, you can see he is asking with the child, see how do you feel when you saw the ice cream. So the child is responding excited, a little scared. So he is asking again, what was that, why you felt excited. Now you can see what type of questions was asked to the child and what was the response. So if you are seeing the response of a particular respondent in a verbal or non-verbal communication when they are taking place, if you are recording that, then you call it as qualitative research design. So when you combine, sometimes you will combine all these two designs, so that becomes a mixed. So now we will move on to the quantitative research design. That is, in research design, if you are taking everything in numerical form, that is analysis of the descriptive and inferential statistics, if you are doing in a numerical form and if you are getting a result in the numbers, then you call it as quantitative research design. So give an example, prevalence of hospital acquired infection among patients admitted in intensive care unit. You can see that here you are going to check how many number of people are infected with hospital acquired infection. So how, which are the areas affected, or you are getting everything in numbers. Okay, that is called quantitative research design. Next is the characteristics. So you can see this quantitative research design will give you a relationship between two variables. Another is use of a repeatable method. That is, as I told you, you will get a result. You can apply this in another situation. Next is the data presentation in tables, graphs, and figures. So whatever results you are getting, you are going to depict that in the tables, graphs, and figures. Next is random sampling. Random sampling means randomly you are selecting the participants for the research process. Next one is standardized research instrument. So as I already told you, this instrument will be well tested and it will be verified, then you will be applied. So you are using a good instrument. Next is use of measurable variables. Like example, you may use the age, sex, everything you will get in numbers. So you are going to whatever variables you are going to use in a quantitative research, everything will be in numbers. So these are the characteristics. Next slide, please. Next is the advantage. So what is the advantage of this kind of research? Collecting data is quick because everything is planned, isn't it? And you know that everything usually in this kind of research, the questions will be in yes or no form. So short answers like closed-ended questions. So you collecting data will be faster. Get a lot of data you can collect at a small time. Can be done remotely. That means now, example, you are doing collecting the data using some social media, maybe using internet, you are collecting the information, so you can collect the data even remotely, various sources. So you can collect the data from various sources like maybe Instagram or you Facebook, any kind of, so those areas you can collect. A large data is required to collect the data. If you have to get a good results, large amount of data is required. Numerical data, sorry, previous slide. Okay. To the advantage will be to the point, the answers will be there, and anonymous data, that is you are keeping the particular the respondent personal data you are not including, so they he will be free to give the response. Next is advantage. Next slide. The answers cannot be changed and it takes more time, and sensitive data is difficult to get. Now example, some personal data relating sex life or maybe something related, that such data will be very difficult to get, then it is costly. Maybe and preparing the instruments and go getting other resources for the study, it may be little costly. Large data is required to get the result, then numerical data is not enough. Sometimes whatever numerical information you are getting for a particular problem, that may not be enough to get a proper idea regarding that problem. So that is a disadvantage. Next is type. So mainly it is classified into three: experimental, non-experimental, and others. That is some specific types. Next slide. Next we'll move on to the experimental type. Experiment means, as you all know, we are doing something, some lab experiment, or in a controlled environment you are doing an experiment and you are getting the result. So next slide, please. So what is the next experimental research design? Experimental research design, you are going to do the research in a controlled environment. So what happens is that you everything is well planned and well decided, and you will get to know the effect of the independent variable on the dependent variable. Next slide, please. So the main three characteristics of this kind of research is that manipulation, control, and randomization. So what is it? Next slide, please. So first one is manipulation. So what is manipulation? Manipulation, press once again, next slide. So what is the manipulation? That is, if you are manipulating the independent variable to check the effect on the dependent variable, you call it as a manipulation. Now, if you want to know the effect of massage in order to reduce the pain, means you are the massage will be the independent variable and the pain will be the dependent variable. So you are using the technique massage and you are manipulating that independent variable. So when you do that, you are ready causing an effect on the pain. So that is called as manipulation. Next slide. Next is control. So you need a control group for comparison. Now example, you are checking a supplement diet on the weight of a preterm baby. That is, a preterm baby will be given some supplementary diet to improve the weight. Or sometimes what happens is that now in this kind of study, even though you don't give a supplementary diet, also the baby's weight usually it increases. So in order to know whether the diet has caused the preterm baby's weight gain, you need a control group. So that is called as control group. Next is randomization. Randomization means you are randomly selecting the particular participants for that particular research. So this can be done in different ways, like flipping of a coin, paper slip, or random from the random table. So when you do all these things, you know, example, you are flipping a coin. What happens when you are putting a coin, both head or tail, any one can become, isn't it? So there each side has equal chance of being selected. That is called randomization. So these three characteristics will be there for a qualitative experimental research design. In experimental itself, again further two categories there. One is classical experimental design, another one is quasi experimental. Classical is also called randomized control design. Quasi is also called non-randomized control design. So we'll see in detail. Next slide. So what is a true experimental design? So in true experimental design, as I already told you, there will be a manipulation, there will be a control group, and there will be randomly selecting the particular sample. So if all these three things are there in the research, then you call it as a true experimental study. Next slide. So in true experimental design, see there are three categories. Next slide. So in true experimental design, it is further classified into basic true experimental design. It is classified into three. That is, first one is post-test only control group design. Next one is pre-test post-test only design. Third one is Solomon 4-group design. So we'll see in detail what is it. Next slide, please. So first one is post-test only control group design. So here you can see in the picture what happens. There is an experimental group and there is a control group, and to those two groups randomly you are assigning the individuals. Then in the experimental group you are giving a treatment. After that, in the control group you are not doing any treatment. Then post test is done in the both experimental and control group. Such test is called as post test only control design. Next slide, please. Next is pre-test, post-test only design. So in this, what happens is that, so from the word itself, you can make out there is a pre-test, then there is a post-test. So you can see in the picture flow chart. See there is a randomly assigning. You are randomly selecting into the experimental group, control group, and both the group you are doing the pre-test. After doing the pre-test in the experimental group, you are doing a experimental treatment. After that, the post-test will be done both the groups. So this test is called as pre-test, post-test design. Okay, next slide. Next one is Solomon 4-group design. So Solomon group design, if you want to know a different or a many effect on a particular phenomena or a particular test or a particular problem, you do this kind of test. That is called Solomon 4-group design. Here 4 groups are there. You can see there is a experimental group number 1, there will be control group number 1, there is experimental group 2 and control group 2. So all these groups randomly you are assigning the individuals, and in the experimental group you are doing a pre-test, and in the control group 1 also you are doing the pre-test. Pre-test will be done only in those two. Then in the experimental group 1 and 2 you are doing the treatment. Then post-test will be done only in the or in all the 4 groups. So such test will help us to identify different effects. So that type of design is called as Solomon 4-group design. Next slide, please. Next slide. Here, there are further classification of this true experimental design. That is some specific true experimental design. That is parallel, split body, factorial, randomized block design, crossover design, and Latin square design. So we'll see one by one. Next slide. First one is parallel group design. So in parallel group design, what we do is in this 2 or more treatment or interventions will be compared. So you can see there in the picture, see there in the randomly you are assigning to the experimental, 2 experimental group will be there. Now you can see the example for you. See there is a randomized controlled trial on the efficiency of continuous versus bolus nasogastric feeding on prevention of enteral feeding associated problem among critically ill patients. So here what we are doing, you are using the continuous nasogastric feeding method as well as bolus nasogastric feeding method, and you are so separate to 2 experimental arms will be there. One into one particular experimental group, you are going to do continuous nasogastric feeding effectiveness, and in another one you are going to check the bolus nasogastric feeding effectiveness. So 2 randomly you are going to assign to 2 experiments, and in both the experiments you are going to do a pre-test, then a treatment will be done, then a post-test also will be done. So at a time 2 test experimental groups will be there, and you are comparing the result of both. So such test is called as parallel group design. Next slide. Next is split body design. So here what happens is that we are dividing the body into 2 halves. So one side of the body will be the experimental arm, another side will be considered as the control arm. Now you can see in the picture, there is an example, more effect of Moist ice pack application in prevention and reduction of pain, bruise, hematoma at subcutaneous low molecular weight heparin injection site. So here what they will do is, now in the right side of that particular where the injection was given on the abdomen, that region moist ice pack application will be done. So that will be the experimental arm. Another side will be considered as control arm. So this is in same body itself, there will be a control arm as well as experimental arm. Such design is called as split half body method. Next one is factorial design. So factorial design is usually used when there are two or more independent variables at simultaneously you want to examine. Then we use the factorial design. So you can see here. Example, you want to observe the effect of two different protocols of mouth care on prevention of ventilator associated pneumonia when performed at different frequencies in a day. So in the box you can see, in order for the mouthwash they are using chlorhexidine as well as saline, and every for the frequency of mouth care is given in the boxes as 4 hours, 6 hours and 8 hours. So in the first box under chlorhexidine, you can see that in that particular individual will be tested with chlorhexidine, will be given with chlorhexidine every 4 hourly. And in the saline group, there will be given with the saline every 4th hourly. Again with the 6th hourly, you will do with the chlorhexidine and with saline. Then again at 8 hourly also, you will do it with chlorhexidine and saline. So if this type of technique is used, you can call it as that particular technique. Next one is randomized block design. So in randomized block design, when you have a large number of experimental comparison group, you use a randomized block design. Now for example, you can see if you want to check the effect of three different types of hypertensive drug on the patients with hypertension. You can see in the ABC it is given, isn't it? Those are the antihypertensive drugs. And in the blocks, they have given patient with primary hypertension, diabetic patient with hypertension, renal patient with hypertension. So in all these boxes, this hypertensive drug will be separately given to patient with primary hypertension, then with diabetic patient with hypertension, then renal patient with hypertension. Then another group of antihypertensive drugs also will be given to the three blocks. Then the third category of antihypertensive drug also will be given to three groups. So this is the change in that. So next one is crossover design. So in crossover design, what happens is that each group will be given exposed to both the treatment. So that is called as crossover design. Now example, you want to check the effectiveness of chlorhexidine and saline mouthwash. You can see in the box, there is a group 1 is there, group 2 is there. Both in the group 1 will give given care with both chlorhexidine and saline, and group 2 also will be given with the mouth care with the saline as well as chlorhexidine. So such a technique is called as crossover design. Next slide, please. Next is Latin square design. So this is slightly different from the randomized complete block design. Here what happens is that when there is too many number of variables are there, and you want to test each variable to each of the treatment, you use this Latin square design. So usually we doesn't much use this particular technique in the health field. We usually use it in the agricultural field. When you are doing the research, you use this technique. Now example, if you want to examine the efficiency of 4 different types of creams in the treatment of dermatitis. Next slide, please. So you can see this square. There are 4 square rows are there and 4 columns are there. In rows, those will be considered as the patients, and the columns will be considered as the different creams which is used for dermatitis. So what you do is each particular individual will be given with all the 4 creams. So that is the effectiveness of all the 4 creams will be checked in the all the one particular individual. So such design you call it as Latin square. Next slide, please. Next is advantages of true experimental design. So as I already told you, true experimental design, you are going to establish a relationship between independent and dependent variable, and everything takes place in a controlled environment. So there will be a purity in the observation of our whatever you are observing in the particular research, and there is less chance for other extraneous variable to have effect on this particular kind of research. And this creates condition in a short period of time, and any kind of bias can be avoided in true experimental design. So this is the advantage. Next slide, please. Disadvantages. So the disadvantage is that as this particular thing is conducted now, there are some types of sometimes this true experimental design we need to do it in a natural setting, like maybe we have to do it in a hospital or community. So such a thing happens, maybe less control on the extraneous variable will be there. And sometimes if it is sometimes it is very difficult to get cooperation from the study participants. And sometimes when you are replicating this kind of research on the beings, there can be some ethical issues can arise. Okay, so these are the disadvantages. Next, moving on to quasi experimental design. So what is a quasi experimental design? These are so a type of experimental design, but it is different from true. In quasi experimental design, what happens is that there is manipulation. But as I told you, the other two, randomization and control, may be there, may not be there. So that is called quasi experimental design. Next slide, please. Next slide. Okay. So the characteristics of quasi is there will be manipulation. That is, independent variable will be manipulated to check the effect on the dependent variable, and there is randomization, and the control group may be present or may not be present. So that is called quasi experimental design. Next slide. So first one is non-randomized control group design. So and from the word itself you can make out it is non-random. Randomly you are not selecting the participant. Non-randomized control group. So there is a control group will be there, but this particular technique is somewhat similar to the pre-test post-test control group design. Next slide. Next, so in this, you can see the picture here. So it is an example for this particular non-randomized control group design. Here, you can see the effect of older people's involvement in social service on their loneliness among elderly residing in selected old age homes in New Delhi. So here, what happens is that this group is divided into experimental group and the control group, and in this particular kind of research design, a pre-test will be done, then a treatment will be done in the experimental group, but in the post-test will be done in both the groups. So that is that particular design. Next one is non-equivalent control group post-test only design. So here what happens is that only the post-test will be done. You can next slide. Next slide. So in this, you can see in the picture, there is two experimental group, and the next one is not experimental, it is a control group. So in the heading, you can see it is only post-test is done. So this particular, both the things, the particular participants are selected not randomly. You are assigning the particular participants, and there is no pre-test, only post-test will be there. Okay, and then the treatment will be given to only experimental group. Next is the time series non-equivalent control group design. So in time series, what you do is there will be a series of observation will be done on the patient. Then in this particular kind of design, and there will be a control group will be there. Next slide. So you can see the picture. See, time series means the experiment or the observation will be done in different series of time. Now there is a given example: effect of the ventilator-associated pneumonia prevention bundle on ventilator-associated pneumonia-related morbidity and mortality among critically ill patients admitted in selected ICUs of a tertiary care hospital. So what they are doing is they are selecting experimental group and and a control group. And they now example, these ICU patients, that critically ill ICU patients are selected for this study. So in experimental group and control group, the participants will be selected from maybe from two ICUs, and in a monthly basis what they will do is they will assess the morbidity and mortality taking place because of ventilator associated pneumonia in this experimental group and control group. After observing for maybe consecutive 3 months, they will give the treatment, that is prevention of for measures for ventilator associated pneumonia treatment will be given to the experimental. After the experiment, again observation will be done in another 3 months. So like that, if the observation in time done in a time series, then you call it as time series observation. Next one is time series design. So in time series design, you can see as there will be only single experimental group, but there won't be any control group for comparison. There is an example. Next slide. This kind of study is mainly done if you want to know the effect of certain kind of treatment. You do this time series design. Now example, you want to check the academic performance of the child. Okay, and you want to check the academic performance on a weekly basis on a child, and after that, based on the performance observation, you are going to give a new teaching method to the child. After that, you are going to again assess the child on a weekly basis. This is called as time series design. Next slide. Next is time series design with withdrawal and reinstitution treatment design. So next slide. Next slide. See, in this picture, you can see the investigator is checking the effectiveness of a detergent, as well as he is checking the effectiveness of a phenolic disinfectant and glutaraldehyde disinfectant. That means three category of disinfectant and detergent is used to check how it is affecting in reducing the bacterial count in the floor of an ICU. So in order to do this study, what they will do is this study is done only in the experimental group. So in the experimental group, first they will check the floor of the particular ICU, okay, for the that bacterial count. Then after that, they will treat. They after a series of observation will be done, maybe in a monthly basis. After the treatment will be given with the phenol. Then what they will do again? They will further assess the floor for another 2 weeks or 2 months. Then after that, they will withdraw that particular treatment. Then they will observe it again the floor for another 2 months. Then they will treat it with another category of treatment. That is, maybe they will be using detergent. So like that, you are giving a treatment. After that, you are checking the effect of the treatment in a series. Then again withdrawing the treatment and starting with another treatment. This is called as time series design with withdrawal and reinstitution treatment design. Next slide. Next is one group pre-test, post-test design. This is considered to be a very weak quasi-experimental design. Okay. Now, next slide. You can see the picture here. See here, what happens is that there will be a experimental group and there is no control group. Pre-test will be done, treatment will be done, and post-test will be done. And in the experimental group, we are not randomly selecting the particular participants. So because there is no control group and randomization, we consider it to be very weak kind of quasi-experimental design. Next slide, please. Next is the advantages of quasi-experimental design. So we consider this kind of research is to be more practical and feasible for the nursing profession. And we are including more of real world natural settings. So that is also an advantage for this. And also we are here we are evaluating the impact of the independent variable under natural situations. And the causal relationship also we are checking between the independent and dependent variables. So that is advantage of this kind of design. Next slide. Disadvantage. So as there is a lack of randomization, or sometimes there won't be any control group, so there is more chance for bias in this kind of research designs. And also we have less control over extraneous variables, so the influence on the dependent variable will be more, and there will be these are some of the disadvantage. Next slide. Next is moving on to non-experimental research design. So what is a non-experimental research design? Now, next slide. So in non-experimental research design, you are not going to manipulate the particular treatment. You are just observing the particular phenomena, and based on your observation, you are going to come to the result. That is called as non-experimental research design. Next slide. So you can see the characteristics. So here what happens is that based on the events that occurred previously, so something which has taken place before or some phenomena which is taking place, and you are analyzing that. That is happens in a non-experimental design. And the control experiments are not performed because of ethics and morality. Sometimes some experiment, because true experiment will not be, or experimental research we will not be able to perform because of the ethics and morality, what I told you before. Since in such cases, this kind of research will be more useful, and the sample and the participant will be already present in that particular phenomena where you are observing. So you are not going to randomly select the particular participants. The another is that the researcher does not interfere with the particular research. Next one is the types of non-experimental research design. So it is divided into five types: descriptive, correlational, developmental, epidemiological, and survey. We will see in detail. Next slide, please. Next slide. So next one is, first one is descriptive. So here what we do, we are observing, then describing, as well as we are documenting what we are observed in a natural setting. That is called as descriptive research design. So based on our observation, we come to a hypothesis, or we develop a theory based on that. Next slide, please. So in that, first type is univariant descriptive design. In this, what we do is frequency of occurrence of a phenomena we are observing. That is different variables which is involved in the study. We are observing that. Now, example, assessing the experience of the patient suffering from rheumatoid arthritis. So when you are observing this, maybe you will observe what are the different symptoms experienced by the rheumatoid arthritis patients, or what were the treatments they have taken. So all these different things or variables related to that particular condition we are observing. That is univariant descriptive design. Next one is exploratory design. Exploring means you are identifying something, then you are exploring and you are describing that particular phenomena which has taken place, as well as the factors which is related to that you are exploring. Now, example, there is exploratory study to examine the multifactorial dimensions of fall, home safety measures for elderly people living in a selected community in the city of Jansana. So in this, what we do, we are observing we know something about the elderly people falling. You want to know more detail about that. Now you want to know what are the causes for the fall, what are the preventive measures the elderly person is checking. So all this comes under that. Next one is comparative design. Comparative means you are comparing and contrasting two or more samples of a study subject, then you call it as comparative. Now, example, comparative study on the health problems among rural and urban people. So you are checking here what is the health problem in the rural community, you are checking the problem in the urban community, then you are comparing that. That is called comparative design. Next one is correlation. That is, you are identifying relationship between two or more variables. You call it as correlational study. Now, example, correlational study on the effect of smoking on lung cancer. So what you're doing, you are checking how the smoking is affecting in the lung cancer. So that is called correlational research design. Next slide. Next slide. Next one, types of correlational research design. First one is prospective research design. That means from the present you are checking, going to the future, or you are starting from a particular cause and you are going to a presumed effect. That is called prospective. Now, example, their correlational study on the effect of maternal infection during pregnancy on fetal development and pregnancy output. So here what we are doing, you are going to a pregnant woman and you are asking what in her current pregnancy, what were the infections she had. If she developed any kind of infection, you are going to observe that pregnant woman and checking her fetal development and pregnancy output. So that is called prospective. Next one is retrospective. Retrospective, opposite of that. You will, from the past, whatever information you are getting, you are coming to the present. Okay, that means, or you can call it as you are going from the effect to the cause. That is called retrospective. Now, example, you want to do a study on the substance abuse related high risk factors among traumatic head injury patients admitted in neurosurgery ICU. So, what you do here, you are going to a group of patients who had head injury, and you are going and asking with them, and you are identifying what were their causes for their head injury. Okay, so from that you are coming to a result. So that is uh, that kind of design. Next one is developmental research design. So in this you are examining a phenomena with reference to a time. Next slide. That is how long the study is taking place. Now example, cross sectional design. So in cross sectional design, you are collecting the data at a particular point of time. One particular time you are getting all the information. That is called cross sectional design. Now assessing, now you are going to assess the awareness on swine flu among people of an area. So you're going and collecting information, and you are getting the result at that time itself. You will know how many people are aware about swine flu. That's called cross sectional design. Next slide. Next is longitudinal design. Longitudinal means if you are collecting the data for a long period of time, then you call it as longitudinal design. Now example, you want to know the perception of the nursing students regarding nursing profession. So when they enter in the nursing profession, you are starting your assessment. You are checking the perception. Then after 4 years of their curriculum, again you are checking their attitude or perception. So it takes a long time, isn't it? Such studies are called longitudinal research design. Next is epidemiological research design. Now you are studying regarding a particular disease condition, the cause of the disease or the distribution of the disease in a particular population. Such studies are called epidemiological. That design which is used for such studies is called epidemiological research design. So in this, under this, you can use prospective approach as well as retrospective approach. So if you are using prospective, it is called cohort studies. Retrospective means it becomes a case control studies. Next slide, please. So in cohort studies, in a longitudinal approach is used to investigate the occurrence of a disease in an existing presumed cause, then you call it as cohort, as I already told you. Then in a case control study, the cause of a disease are investigated after the occurrence of a disease. That is called case control studies. Next slide. Next is the survey research design. In survey, what we do is you check the, you collect information from different subject within a given population, having some similar characteristics in the population. So such data collection is called as survey research design. Means if you want to know the opinion or perception or behavior or action or attitude regarding a particular population, you can use this kind of research design, and it can be descriptive, exploratory, or it can be a comparative or a correlational. So depending on the survey, it is divided into, if it is a descriptive data, then it becomes a descriptive survey. If it is a exploratory survey. If you're comparing and contrasting two things, then it becomes a comparative. Or if you're correlating two things, then it becomes a correlational survey. Next slide. So the type of survey is also further classified based on the data collection, how you are collecting. If you are collecting data on a written survey, then it becomes a written survey design. Now example, from written to from a structured tool like a questionnaire or opinionaire, using that, if you are using that, then it becomes a written survey. Or if you are using a face-to-face conversation or a telephonic communication or a oral interview, that becomes a oral survey. Now, or you are using a email or web form or a mobile or short message you are using, it becomes a electronic survey. Next slide. Next is advantages. So what is the advantage of using this non-experimental? You are checking closest to the real life situation. Even though you are observing a natural phenomena, and most suitable for nursing research studies. And the numerous human characteristics are inherent, not subject to experimental design. In experimental design, in such things you can use this kind of research. Hello, can you hear me? Hello. Hello, am I audible? Hello,
Yes, ma'am, audible. Hello.
can you hear me?
Yes, yes, ma'am, audible.
I think the network got disconnected. Network, I'm not able to see the slide.
Slide. We will try, ma'am.
Yeah, I think the first slide you are in non-experimental. Yeah, yeah. Further, go front, further. Yeah, advantage. Next, disadvantage. Next slide, next slide. It got yeah, just go little back, one slide back. Okay, one more slide. Back, back, back. Previous slide. Okay. I was dealing with the, yeah, stop there, stop there. Next slide, next slide. Okay, disadvantage of non-experimental research design. So in non-experimental research design, disadvantage is that as there is a the result obtained or the relationship between dependent and independent variable can never be absolutely clear or it cannot be error free. So that is another one disadvantage. And as we are not randomly selected groups, so there is a chance which may not be homogeneous, or there may be because there can be some lot of differences in the characteristics of the samples what we have selected. So that is one disadvantage. So when such things happens, the authenticity or generalizability of the particular results cannot be assured. Next is the specific quantitative research. That is this kind of research designs which are classified based on the purpose of the study. So that becomes a specific quantitative research design. Next slide. Next slide. Next, okay, clinical trial. So in clinical trial, what happens is that this kind of clinical trials are usually done in order to check the efficiency of it. This is usually done on the human subjects. So before doing this, what you do is you do a preclinical testing of the drug or device. Then a permission or approval will be taken from the health authority. Then the clinical trial will be done, and it will be done in a 5 sequence of steps. So that is called clinical trial. Next slide. Next slide. Okay, next is the evaluative research. So now you are want to judge a particular specific program or practice or procedure or policy. We use a evaluative research. Now you want to check the evaluate a health program, or example a national rural health mission program. If you want to evaluate, or how it has been implemented, if you want to check, you can use this evaluative research design. Now in these two types are there: formative evaluation and summative. Formative means at when the particular program is taking place itself, you are going to assess, evaluate. Then if at the end of the program, in order to know the outcome of the program you are doing, that means it becomes summative evaluation. Next slide. Next is the outcome research. So you may feel that this is somewhat similar to the evaluative research design, but there is a difference. In evaluative, you were checking the effect, you are evaluating the program or policy. But in case of outcome research, you are going to check the effectiveness of a particular nursing service or nursing care service or a nursing practice. So that becomes a outcome research. Now, example, you want to check the quality assurance program in a particular hospital, then you use a outcome research design. Next one is methodological research design. That is, you are developing a instrument, okay, and you want to evaluate or you want to test or you want to know how effective that particular instrument is. So such, if you are using that particular, if you want developing a particular instrument, then you use a methodological research design. Next one is secondary data analysis. Now you, somebody has collected a data, they have done some research, they have come up with a conclusion. You are reanalyzing that particular data to come to a new hypothesis, then you call it as secondary data analysis. Next slide, please. Next slide, please. Next one is operational research design. See, this is the operational research design. Usually it is used in organization or in service. Now you are observing or studying a particular human organization or service, and you are collecting some information. And based on that particular information, you are developing a particular new technique to help in improvement of that organization or service. Okay, that is that one. Next one is meta-analysis. In meta-analysis, what you do is you combine the results of many studies related to a particular data, okay, or a particular topic. Then you give the result in this, you do a statistical analysis and you get the result. Then you call it as meta-analysis. Next slide. Ecological studies. These ecological studies are like epidemiological research design, where you are now you get the result in now in epidemiological research design, you in a group you are observing something. Now example, ecological study of tuberculosis in a particular region in California. So what happens is that you are getting the measurable values of a particular region. Now, how many people have been suffering with tuberculosis in that region? In California, how much? In other regions of USA, how much it is? So like that, you are checking the effect of that particular disease in a group. Then you call it as ecological study. So you get data for this ecological studies usually from the disease registries all. So these are the different types of of the section. So, excuse me. Hello, can you hear me? Are you there? Can you hear me? So we have come to the end of the section. So as I told you, hello.
Yes, yes, ma'am.
We have come to the end of the section. So until now, we have seen different types, yeah, different types of qualitative research design. So this research design is a very important part of our research. Always research design, we are, if the research design is good, you can get a good result. Now, sometimes there are situations where we have to use two or more research design to come to a hypothesis of a problem. So that is very important that everyone should know how well a research design can be applied and what particular research design has to be selected so that you can get a good result. Thank you. Can you hear me?
Yes, ma'am.
So do you have
Thank
any
you very
doubts?
much. No, no, thank you very much, ma'am. Any question from participant regarding this quantitative research design? Very much, Professor Divya Rani Madam, for sharing your deep knowledge out about the quantitative research design with us. Thank you very much, ma'am. Now, I would like to request Professor Savita Vyas, ma'am, for
Thank you.
Good afternoon to all. Myself, Associated Savita Vyas from Dr. Subhash University, School of Nursing, Junagadh. According to Oscar Wilde, the smallest act of kindness is worth more than the grandest intention. Honorable Chief Guest, presence, Excellencies, Principal, teachers, and my dear students. I thank Dr. Subhash University for giving me the opportunity to express my gratitude on this special day. It is the biggest day in the history of our university. We have hosted international e-conference on research methodology in nursing. I thank our respected president of Dr. Subhash University, Rajbhai Chavda sir, who graced us with his presence and guidance. Thank you, sir, for your words of wisdom. And also thanks our provost, sir, Dr. Deepak Patel, sir, who have been a constant support and you have given us a lot of encouragement. Thank you very much, sir. I thank all our national and international expert speakers by giving us deep knowledge regarding research methodology on different topics. Thank you very much, sir and madam, for your expert talk. We have been fortunate to assisted by our principal ma'am, Professor Sevanti Ashok Managuli. Thank you, ma'am. I would like to thank all those organizing team, teachers and students. Once again, on behalf of Dr. Subhash University School of Nursing, Junagadh, thank you one and all.